Thank you so much of having us this night. Good afternoon everywhere. I will speak today about rebuilding the dermatological healthcare system in Gaza during and after the war. I would like to start my presentation with sharing a personal story about Gaza. As you all the world know, the situation in Gaza is very bad, and after the 7th of October, after around half a year from this genocide, the stories came out of Gaza about the casualties and also the injuries, which exceeded the most terrible predications of any medical professional. At the middle of 2024, the news came that there is a large number of new skin diseases in Gaza because of the ongoing war. Was the need for some dermatologists to enter Gaza. Before that, as you know, was the priority always for the surgical specialties, for example, orthopedics or vascular surgeons to enter Gaza in order to help the medical staff there. So in September 2024, I tried to enter Gaza for the first time. It was not an easy task at all because as a dermatologist in a crowded clinic in Germany, I had to reschedule vacations, also to postpone and reschedule hundreds of appointments in order to join the medical team who will enter Gaza. We tried to enter Gaza under the umbrella of an American NGO. I traveled to Jordan because at that time and till now, there is only one way to enter Gaza after taking the permissions from Israelis authorities. You must go from Jordan or from the capital of Jordan, Amman, through or across King Hussein Bridge, through Palestine, and you have to enter Gaza across Erez crossing. One day before our mission, King Hussein Bridge was closed. All missions was cancelled, and unfortunately, I returned back to Germany without participating in the previously planned medical mission in Gaza. 2 months later, end of November 2024, the King Hussein Bridge was reopened and our mission was allowed to enter Gaza. Because of very complicated situations and permissions and procedures, the travel between Amman and Gaza took around 12 hours. I was allowed to stay in Gaza for 2 weeks. The first week was in South, in Nasser Medical Complex, and the second week was in North, in Al-Ma'madani Hospital. I find it better to make this presentation with voices from Gaza. So it is my great pleasure to introduce Dr. Fanana, a true hero from Gaza, which works in the front lines there. She recorded this message especially for us to help us and the world understand what medical professionals in Gaza are facing. Let us hear from her about the situation in Gaza nowadays.
Hello, colleagues. My name is Dr.
It's working, yes? Is it
Yes,
working?
it's okay now.
Thank you.
It's okay now.
Thank you so much.
Karim Fanana, a family physician in Gaza, where healthcare is practiced under siege and horror. Today I will share with you our healthcare system collapse, particularly in dermatology. I work as a family physician in one of only 2 clinics that remain undestroyed in Gaza, here in northern Gaza. We see about 2,000 to 3,000 patients daily, with more than 150 patients per physician. Dermatologic cases now comprise 30% of presentations, increased by overcrowding, malnutrition, and destruction of water and sanitation systems. The shortage of food also and clean water has led to decreased immunity in our population, resulting in more severe and complicated. Hello, colleagues. My name is Dr. Reem Fanana, a family physician. Physicians and general practitioners will face significant challenges in treating complex cases. Yet we must adapt to meet these needs. Given the limited resources, we, as a family medicine doctor, had to take the responsibility of diagnosing and treating these conditions. There are many infections outbreak, like impetigo, scabies, tinea, with severe complication like Kirion. We lack sufficient antibiotic and antifungal to treat infection, which often present in complicated forms. Now we face cases of recurrent chickenpox in children and adults due to malnutrition, which was rare in peacetime. For the first time in this war, we see widespread cases of infected sweet rash across all age groups caused by hot, humid, and conditions in shelters and due to severe water shortage. Also, flares of chronic diseases like psoriasis, hidradenitis suppurativa, and neurocystic acne due to stress and treatment interruption. Without access to basic diagnostic tests like as simple as KOH, we treat patients empirically with topical or even oral antifungals. These challenges drive us to expand our knowledge in dermatology to better serve our community. So throughout the past year, I have actively contributed to medical education by training medical students, junior doctors, and colleagues on diagnosing and managing common dermatologic conditions in the primary healthcare settings. Given the lack of specialties, I prioritized sharing knowledge through teaching sessions and clinical case discussions to enhance our collective ability to manage dermatologic cases effectively. In the future, we hope to have a structured dermatology training program for doctors. And additionally, we hope to integrate into online learning and face-to-face training with other professional practitioners outside Gaza and have him here to help us, like Dr. Qasim and others do. They helped us a lot and we appreciate this. Thank you for this opportunity to share our situation here in Gaza and have a good day.
So this is the situation nowadays in Gaza. I tried also to have 2 dermatologists from Gaza in this lecture, but unfortunately, because of the very bad humanitarian situation there, they apologize to be with us today. I will move to share a message from Qasim Abu Elrub, who is helping us understand one of the most painful things in Gaza nowadays, the difficulty of getting medicine into Gaza. Imagine, for example, that treating hundreds of patients without antibiotics, without painkillers, or basic supply. I've recorded this video to help us understand the logistics situation in Gaza.
Hello everyone, thank you for the opportunity to speak today. I am MVZ Abu Elrub, a pharmacist working with International Medical Corps and the Gaza emergency response. I started working in Gaza in December 2023 and I continue to serve there to this day. Today I'm here to share with you the reality of working in Gaza, how hard it's to provide medical care and the impossible decisions we must make every single day as a medical team. Unfortunately, it's not a job, it's a daily fight for survival. In Gaza, we don't just manage stocks or count boxes, we make decisions every day that feels like life or death. As you know, Gaza is under blockade. Supplies don't enter freely. Borders close for weeks, and now we even are talking about months. We wait for shipments that may never arrive, and yet we have hospitals full of patients, injured people. People need surgeries, medications, and basic care. Every shipment we receive is delayed if it arrives at all. We run out of basic, critical, and essential things like painkillers, anesthetic medications, IV fluids, or even simple things like syringes or gauzes. Imagine telling doctors that, sorry, doctor, but we don't have gauze or we don't have surgical gowns today, or telling a mother, sorry, we don't have medicine for your child. Unfortunately, this is what we deal with every day in Gaza. But there is another layer to the crisis. Gaza is not a normal emergency mission. We are dealing with mass casualties, dozens of injured people arriving at the same time after airstrikes. In a normal hospital, the supplies we have might last for weeks or months, but here in Gaza, they are used up in hours. The needs are massive and the resources are simply not enough. And it's not just injuries. We are also seeing a sharp rise in infectious disease and outbreaks. People, as you know, are living in tents with no access to clean water, no proper sanitation, and no hygiene products. Without soap, without clean toilets, and without clean water, diseases like diarrhea, respiratory infections, and skin infections spread rapidly, especially among children and the elderly. And when these diseases spread, we need even more medications and supplies, but we just don't have enough. Unfortunately, every day we face painful questions like who gets the last box of medications, or should we give the remaining quantity of antibiotics to one patient who has the higher chance of survival, or we should split it in between several patients because we believe that everyone deserves a chance. So in Gaza, unfortunately, we are forced to prioritize, ration, substitute, and delay, not because it's right, but because it is the only way to keep the hospitals running. I want you to understand that working in Gaza is not just hard, it's heartbreaking, honestly. But we keep going because there is no other choice. If we stop, people will die. So when you think about Gaza, I ask you to remember behind every number is a human being. Every delayed shipment has a face, a name, a family, and every tough decision we make is because we simply have no other option. Thank you for listening.
I think everyone know what is happening in Gaza. The number of casualties is very, very high. Till today, we have around 54,000 confirmed killed human beings, plus thousands of others which are under the rubble. And here nobody has enough statistics about that. I think every day a large number of casualties came, and this is very, very bad and serious. Nowadays, around 80 or 92% of all buildings in Gaza have been damaged or destroyed since the start of this war. I took this video during my mission in Gaza, and I need you to imagine how is the situation there. Under each building in Gaza, there is stories, there is casualties, and unfortunately, the medical staff there have no choice to help the people under rubble. I will move now to speak about a plan to help in dermatology services in Gaza now and after the war. I will speak about 5 aspects. I think the most important thing to know is the effective dermatological care and the effective medical care reform can only begin after the cessation of war, because every day there's casualties, and unfortunately the war destroyed everything. And if we or any effort to help the system will not be sustainable if the war goes forward. The current situation in Gaza is very bad. You know, there are genocide, starvation, and medical blockades, and this affects every medical specialty, every hospital, every clinic. So I think if we need to say what is the most important thing to be done, the most important thing to be done is to stop the war. At the level of human resources, in Gaza, there is a dermatology gap or a problem in dermatology. Unfortunately, before the war, Gaza is very poor with dermatologists. So I think before the war was only 3 colleagues with a specialty in dermatology. And this told us how it is severe to work there and to give enough and efficient dermatology services. I believe that we have to plan to have around 20 to 30 dermatologists in Gaza. The population in Gaza is around 2 million people. So if we say we need 1 dermatologist for every 40,000 human beings, it will be enough and efficient. I think we have to think in 2 levels, the short-term level and the medium-term level. In the short-term level, I think we have to concentrate on remote training and tele-education. What is the medical staff, the doctors, the family physicians, as Dr. Rima and other colleagues do in Gaza is unbelievable. They have a huge number of patients. They have to treat these patients, unfortunately, sometimes without medication, and they need a lot of support. But I think the telemedicine or tele-education will help to improve this situation a little bit. In the medium term, I think the best solution is to send some of the colleagues from Gaza or to make a dermatology training and return back to Gaza to help the people there. I believe that if we need to estimate the cost to make or to have around 30 dermatologists in Gaza, we need around €1.5 million. The third level, I think, is the level of medication shortage. As Abda told us in the video, it is unbelievable. Since 3 months, there is or nothing enter Gaza. We are speaking about food, about medication, about everything. So all medications are in critically short supply in Gaza. That means each medication will help the people in Gaza. I mean this for every specialty, for every hospital, not only for dermatology. I think that, as I said at the beginning, the most important thing to open the borders and let the medication enter to Gaza. I estimated the cost for the needed medication in dermatology for 1 year to be around €17 million. If we need to think about the next step after stop the war, I think we have to start very quickly with a small clinics. In dermatology, as a large number of you know, we just need a good physician. We need a dermatoscope and sometimes cryotherapy. These things are very easy to have. And I think if we start with 50 dermatology clinics, it will be enough. These clinics should not be normal clinics. Maybe there will be a movable clinics. And here we have, for example, some colleagues with dermatology experience, and maybe they will have another 2-3 colleagues or also medical students who can help, and we can run around 50 dermatology clinics. After that, I think we can, when the situation is more stable, we can move to a normal dermatology clinic. And here I think it is very, very important to supply these clinics with laser equipment in order to help in treatment of war-related skin injuries and scars. I think that for the secondary dermatology services, I mean, for example, the light therapy or some small procedures, I think 2 inpatient departments, for example, in Al-Shifa Hospital in the north and in Nasser Hospital in the south, will be enough at the first level. This photo was taken by me from Nasser Hospital at the beginning of our mission. Unfortunately, the news told us today that Nasser Hospital will be out of duty in days because of shortage of everything, fuel, medication, and also, unfortunately, the strikes, the Israeli strikes also attack Nasser Hospital as a Shifa for around 1 year. Here we have to make it clear that every effort, I think, should be under the supervision and under the umbrella of Ministry of Health, because they know how the system works in Gaza. And as the experience in Gaza was that maybe 90 or 95% of all medical services in Gaza was before war under the umbrella of Ministry of Health. I think they can also use the resources very efficiently, and they can help to make these plans very effective. This picture was taken also by me during our mission. We can see how the people live. Unfortunately, I know that the situation nowadays, after 6 months, is also very, very bad. Large number of people have problems with food. They cannot find food for their children. And I think the news which came out of Gaza told us a lot about that. I need to move to the take-home message from this presentation. I think what is very important is to keep speaking up about or for Gaza. Because silence allows the suffering to continue. Please use your voices online, speak with colleagues about the situation and about the demand of protection for the medical workers in Gaza. Speaking up shows that all of us thinks about Gaza, and maybe it will put pressure on policymakers worldwide. I think that every effort matters. Even small acts will help because there is a shortage in everything. And I think even if we do a little bit sharing of the stories from Gaza, donating or to help in any way, it matters a lot for the people on the ground and the medical staff there also. I think that the medical staff needs a lot of support. And here I need to speak about the importance of support training there, because the doctors in Gaza work under unbelievable and unimaginable pressure. And I think they deserve the chance to grow and to learn. Supporting medical education, remote training, exchange can help auch build a resilient health system. And I think that investing in these colleagues and doctors is investing in Gaza's future. I just need to say at the end of this presentation that despite everything, the children in Gaza still find a way to play. Their resilience reminds us of the strength of the human spirit and why peace is worth fighting for. Thank you so much for your attention.